Hi everyone, I'm Rachita. I moved to Canada in February 2021 and I had my first baby in November 2022. As a newcomer to Canada and as a first time mom, there were a lot of things I didn't know about pregnancy and the care in Canada. I have learned a lot of things along the way and I'm going to share everything with you. Questions like who should I see for my prenatal care? How do I find the right doctor? Where can I give birth? All these were swirling in my head, and I did not have answers to it back then. I wasn't familiar with the difference between the family doctor, gynecologists, midwives, and doulas, and how they play a part in your pregnancy. I learned a lot since then through trial and error, and I made a lot of mistakes along the way. But I also gained valuable insights that I wish I had known earlier. That's why I'm making this blog to share my experience with you and help others who might be in a similar situation, whether you're a newcomer like me or a first time mom trying to figure things out. I hope this blog can help you through the process and make your pregnancy journey smoother. In this episode, I'm going to talk to you about something super important, the roles that your family doctors, gynecologists, midwives, and doula will play a part. I'm going to also talk to you about how to choose the right care provider for you, where you can give birth, and also some of the mistakes I made during my pregnancy. I also want to mention that all the care for you and the baby is covered by the provincial government. So if you are eligible, I would first recommend you to get your health card. The next thing I want to talk to you about is the difference between a family doctor, a gynecologist, midwives, and doulas. They all play a different role when it comes to pregnancy and childbirth. So we will need to break it down to understand the difference between them. So let's first talk about family doctors. The point of contact when you find out that you are pregnant or you're planning to have a baby in the near future would be your family doctor. They would do all your prenatal care, recommend the prenatal vitamins to take, the dietary needs, and also give you referrals for your blood work and ultrasounds. Usually, the appointments would last between 10 to 15 minutes, and if you have any complications during your prenatal care, then they would be able to refer you to a specialist. Not all family doctors deliver babies, but for those who do not deliver babies, they will refer you to a gynecologist or a midwife, whoever you choose to go with. It's always easier to talk to someone you are comfortable with, so I would recommend you to first get in touch with your family doctor once you find out that you are pregnant. So the next person that you would be seeing would be a gynecologist. A gynecologist is an expert in pregnancy, childbirth, and disorders of the reproductive system. So if you are a high risk pregnancy, you would be referred to a gynecologist from the early months of your pregnancy. They would be doing your prenatal care, your labor and delivery. If you are a low risk pregnancy, then you would and your family doctor does not deliver babies, then you would be referred to a gynecologist only towards the end of your pregnancy. The OBGYN that attends your delivery may or may not be known to you, as they often work in shifts and it depends on the doctor on call. But if you go via the midwife route, it's going to be a totally different approach. So next, to talk about midwives. So your midwife are experts at low risk pregnancies. So they would be a primary care provider during the entire pregnancy. They would be the only person you would be seeing for your prenatal, your labor and delivery, and also for your postpartum care. The midwifery services are funded by the Ministry of Health and Long-Term Care. So they are usually free to clients. Even for women without OHIP coverage, you can get midwifery services. But however, your lab tests, ultrasounds, and hospital visits will have to be covered by your OHIP. Your midwife appointments are usually 30 to 45 minutes long. You get to know a small group of people, and very often during your labor and delivery, it would be with someone you know. And midwives are able to help you give birth in the hospital or at a birth center or at your own home if you choose to. They will also be with you for 6 weeks with you and your baby after giving birth, which I think is wonderful and much needed, especially if it's just going to be you and your partner and you do not have families close by. And also, if at all, if there's any complication that comes up during your prenatal, they will always be able to refer you to your OBGYN. Now, to talk about doulas, doulas are a little different. They aren't medical professionals and they are not covered by the OHIP. They are like a birth coach. They offer you emotional and physical support during your childbirth, and they help you manage your stress and pain and also advocate for your birth plan. They're great if you're looking for extra support and someone to help guide you through your childbirth. And they also help with postpartum care in terms of breastfeeding and how to care for your baby. This would be super beneficial for anyone who's going to be a first time mom or who does not have any family close by to rely. Let's now talk about how to find the right doctor or a midwife for you. It's not as overwhelming as it sounds. I did not have a family doctor when I was pregnant, but I was able to find one after I gave birth through a colleague. So I would recommend asking around, ask your friends, ask your colleagues. They might know of any family doctor that's coming in or any doctor that is taking in new patients. There's also your local neighborhood and mom groups on Facebook. This is a gold mine for recommendations. They will be willing to help you if you ask them if they know of any doctors that are taking in new patients. Because I did not have a family doctor, I went into a walk-in clinic when I found out I was pregnant. I went to Apple Tree. It was a 2-hour wait to see a doctor, but he was able to write a referral to get my blood work and ultrasound done to confirm my pregnancy. And then he just asked me where I live and gave me a referral to a gynecologist who was working in the closest hospital to my place. Obviously, I did not do any research. I was not happy with the care that I got from my gynecologist. So I would implore you all to speak with other moms, either on Facebook groups or on other social media platforms. Ask them about their experiences, ask them about their recommendations, what went well, what did not go well. You'd be surprised how many people are willing to help you find the right care provider. I'm sure if you ask around, you'd be able to zero down on a gynecologist or a midwife that is best suited for you. Next, read reviews, be it on Google or on your local healthcare site. Check out what other parents are saying about their experiences with their doctors or midwives. Reviews will be able to give you a rough idea of their bedside manners and experiences and whether they're the right midwife or doctor for you. I wrote a review based on my experience with my gynecologist, hoping it would help other parents make a decision. So I'm sure if you're able to shortlist on a couple of doctors and midwives and search on Google, and you would be able to zero down on a couple of doctors, and then you can call their office or ask your family doctor to give you a referral to this gynecologist since you think they are the right fit for you. Here's a tip: get care early. Don't wait too long. Get a doctor or a midwife lined up early because you need prenatal care as soon as possible. They'll guide you on what supplements to take, what folic acid tablets, and what iron supplements you need. So this is very, very important to make sure you and your baby are healthy during pregnancy. I didn't hear back from my gynecologist office until a month or later after meeting the doctor at Apple Tree. So I didn't know I had an iron deficiency, so I wasn't taking tablets very early in my pregnancy. So I would definitely recommend you get care very soon. Next, to talk about where to give birth. So you either have the option of giving birth in a hospital or in a birthing center or at home. For high risk pregnancy, it is advised to be giving birth in a hospital because you would have access to a gynecologist who are well trained in such situations. But if you are a low risk pregnancy and you want to give birth in a hospital, then I would recommend maybe you can take a tour of the hospital to see the labor and delivery room and see how comfortable you are in that environment. You can also see what comfort measures they have at the hospital and if it's best suited for what you need. You might also want to ask about their policies, what natural birthing options they have if that's the route you want to go. And you also want to see if your midwife or doctor is able to help you with your labor and delivery in that hospital. So a birthing center is in between a hospital and a home. They are much more suited for low risk pregnancies and for someone who wants a more natural, holistic approach to giving birth. They are usually run by midwives, so speak to your midwives and see if they're registered with any birthing center. You may be able to go and take a tour of the facility and see if you're comfortable in that environment. So if any complications arises during your birth, they will be able to move you to a hospital. You also have the option of giving birth at home if you're a low risk pregnancy. Speak to your midwife and see that they are licensed, and make sure your home is set up for this. Also have a backup plan just in case you need to go to the hospital. Remember, this is your birth experience. It's a beautiful moment, so choose something that makes you comfortable and safe. Now let me share something personal and tell you what I would have done differently if I had all the information I had shared with you right now. I would have researched a bit more and probably gone for midwifery services. I had no emotional connect with my gynecologist. I did not receive any input from her. I had to do all my research and I did it too late into my pregnancy. I feel like a midwife service would have been much more personal, and since I was a low risk pregnancy, I would have preferred a much more natural approach to my childbirth. I also would have joined mom groups sooner. You learn so much more from other women in your community who have gone through a similar experience. I know every childbirth and pregnancy is different and it can feel very overwhelming when you're doing it alone. But knowing your options and having a support system in place makes a whole lot of difference. So, whether you're deciding between a gynecologist, a family doctor, or a midwife and a doula, or whether you are going to give birth at home or the hospital or at a birthing center, remember this whole thing is about you and your baby. So, make a decision that is best for the both of you and wherever you are comfortable with. Thank you so much for watching. If you found this information helpful, please give it a like and subscribe to my channel for more information on pregnancy advice and tips. Also, let me know in the comments what more information you are looking for. I would be happy to share anything with you.